I now recognize Ms. Lesko from Arizona for 5 minutes of questions.
Thank you, Mr. Chair, and thank you to all of you for being here as witnesses. I wish Representative Dingell was still here because I found her conversation interesting. She said that she would not take a flu vaccine again, and that she talked to multiple doctors and decided to get the COVID vaccine. The thing is, she had a choice, right? She had a choice, and that's the difference. So many other people, it was a mandate, and that's what's wrong. I support people having a choice. If they want to get a vaccine, get a vaccine. If they don't want to get a vaccine, they should not be forced by our government to get a vaccine. Dr. Bardosh, I have met with constituents who have lost children to the vaccine injuries without any acknowledgement, sympathy, or recourse from the government that encouraged and forcibly imposed the COVID-19 vaccines on them. My staff and I have worked with a former constituent since he was injured by a COVID-19 vaccine. It has been medically confirmed by a very reputable medical institution that he contracted Guillain-Barré syndrome from the vaccine. He spent over 3 months paralyzed in the hospital. He is still in the recovery phase of his injury. To date, he still needs IVIG, intravenous immune globulin infusions every 14 days, a process which takes approximately 4 hours each time. He also needs a rituximab infusion every 6 months, and rituximab is a chemotherapy drug that kills off the antibodies in his system. He has lost his career due to his injury, and as a result, he and his wife have been hit by severe financial hardships. He has had his CICP claim, which is the government compensation claim, open for 18 months. They have had his medical records for over a year, and he has heard nothing from our federal government on when he can expect a resolution. It is very worrisome that people are not being adequately compensated for injuries resulting from the COVID-19 vaccine as they would for other vaccines. Dr. Bardosh, do you think this lack of recourse has implications for public health more broadly?
First of all, that sounds like a very tragic story. And those stories are not unique to one individual, unfortunately. I think it's hard for the public health community to acknowledge side effects like that, but they really need to. And it's clear that the vaccine injury system in the country is broken, not only in this country, but also in Canada and elsewhere that I'm familiar with. Yeah, it's obviously something that's very alarming, and there needs to be a concerted effort. I'm not sure what the process can be, but to reevaluate these injury court systems. Because I've had people reach out to me who also have been injured, and they've said, look, I've been dragged through the mud in the bureaucratic red tape. And even I have confirmation from my doctors that actually there is a causative link here, which does happen, right? And yeah, there's sort of an inhumanity to the bureaucracy that I think really needs to be looked at.
Thank you. And for those that are listening, the CICP is the government's countermeasures injury compensation program that is supposed to compensate people for adverse effects from COVID-19 vaccine. And that's what he has tried to get for over 18 months and has not even gotten an answer. Dr. Bardosh, in your May 2022 paper, you wrote, our analysis strongly suggests that mandatory COVID-19 vaccine policies have had damaging effects on public trust, vaccine confidence, political polarization, human rights, inequities, and social well-being. Do you know if people in countries that have properly acknowledged and been compensated for their vaccine injuries have less overall vaccine hesitancy and more trust in their public officials?
That's a really good question. I would need some time to really be able to answer that because I have not looked at the data in sufficient detail. But I mean, my intuitive response is yes. Certainly, if you look at, for example, the Nordic countries, Sweden, Denmark, et cetera, they had a narcolepsy problem with their H1N1 vaccine back in 2009. And they overhauled their vaccine safety system to build trust. And as far as I'm aware, their vaccination rate is higher than the United States for COVID. So I think acknowledging these safety signals does build trust. And actually, a study comes to mind where they actually looked at this issue, right? So the problem is, if you acknowledge a safety signal, it does decrease trust, because people say, oh my goodness, this vaccine is not safe. But over the long term, it builds trust. And so what we're doing here right now, on what we've done with mandates, in my opinion, is we've sacrificed long-term trust for short-term gain. And I just think that was a bad decision.
Thank you, and my time has expired, and I yield back.
Now recognize Ms. Takuda from Hawaii for 5 minutes of questions.